These are unprecedented times, and it's very important that we all follow the advice. I'd like to introduce to you Dr. Stephen French, one of our GPs from Bexhill, who's going to outline to you what is happening and what you can do to keep safe.
Thanks, Hugh. We're dealing with a new and dangerous virus that spreads very easily. It can cause breathing difficulties, needing intensive care treatment, and can lead to death. If we don't control its spread, then the NHS will not be able to cope with the predicted number of people requiring care. To save lives, we must reduce the spread of the virus. Follow self-isolation advice if you or a member of your household has symptoms. Symptoms can include fever, new onset persistent cough, aching muscles, fatigue. If you've been in a household of someone showing symptoms, you must remain isolated for a minimum of 14 days. If you're unable to cope with your symptoms, for example, if you have difficulty breathing, please call 111. For medical emergencies, call 999. Do not stockpile medication. Only order prescriptions when you need to and in good time. Regular hand washing is essential. Whenever you've been in a public space, avoid touching your face and wash your hands thoroughly afterwards to reduce risk of acquiring the infection.
So we've seen many changes to our lives this week, but as Stephen's just explained, these are vital if we want to beat this epidemic. It's also vital that we look out for our loved ones, our friends and our families, and so do keep in touch with them by phone and by video links. This is a time for self-discipline, self-isolation and selflessness. We will get through this if we carry on doing the right thing. If you want to know more, please contact my website, hughmerriman.org or gov.uk, where all the advice is in place.
The most important message we can give you is stay at home.
So do help the NHS by self-isolating and self-distancing, and do your bit to help save lives.